Good evening, Chairwoman Scanlon, ladies and gentlemen of the Freeholder Board, Bruce Patterson, Carver, New Jersey. I noticed in parentheses in the reading of this, it says retiree health insurance benefits. If anybody would like to clarify what exactly that is doing, is it making something more favorable? Does it actually pertain to maybe the constitutional officers? You know, we have two of them, obviously, so it doesn't pertain to that. And even if somebody planning to retire or something like that, this is very interesting what this is doing. If somebody could explain that to me. Thank you.
Thank you, Chairwoman. The intent of this is, as you know, we've had many negotiations with unions, corrections unions, law enforcement unions, Council 8, and in exchange for a number of years of zeros of the existing membership, we have provided in exchange for 0% increases on salaries, health benefits for life for existing members, not new members that come on at subsequent dates. Our exclusionary employees have now gone, including 2011, some have gone 3.5 years without a raise, and we thought it fair to bring them in line with what we've been negotiating with the unions, and this ordinance does not apply to constitutionals.
Loretta Cranford, can you tell me what the cost of this is going to be annually? If there's an estimation, and also can you give an overview of what exactly the fees for recreation facilities, how those are changing? Thank you.
Director Caroselli will respond to that question. Those questions.
The Chairwoman, through you, the costs associated with this are currently being evaluated. We're in the process of receiving an actuarial study to determine exactly how much the zeros, how many zeros would actually equate to the total cost associated with this, and then what we'll do is, as we've done with the unions, we will set aside an appropriate amount of money in each of the respective budgets in order to offset this cost.
Madam Chair, and Larry, maybe I can add to this if I'm mistaken or misspoken, please correct me. But in the past, the actuarials have shown that 2 zeros has been more than sufficient to cover the past unions, and that the reason we're doing the actuarial here is more for planning purposes for the future, and that we're confident that the 3.5 years obviously would be sufficient.
Yes, we are confident that those 3.5 zeros would be sufficient, but as we've done with all of the unions, you know, it's appropriate for us to have these actuarial studies in order to determine what the actual cost will be, and then correspondingly how much we would be setting aside.
All right, thank you. Are there any further questions with regard to the committee of voters?
Yeah, John Burry, Kenilworth. What does 3.5 zeros mean? What is that?
Someone can correct me if I'm wrong, but I believe it means that for 3.5 years, the exclusionary employees have not been given any raises.
Oh, I thought it was something to do with the cost. How many people are involved altogether?
I believe it estimates to between 600 and 700 total employees that are affected.
Larry, you might not want to sit too far.
No, it's okay. And the last thing is how would this, well, first of all, the actuarial study, you could get actuaries to give you anything you want. I just don't go by that. Especially in this field where health benefits, it's completely in flux. What will Christie's proposal to have 30% of their benefits being paid? I guess that's going to go through. I mean, he's going to embarrass people into passing that. Will that affect these people as well? Will they have to start chipping in, or was it exclusive of whatever a Republican governor might decide to do.
Through you, Madam Chair, anything that goes through the legislature similar to the 1.5 contribution last year would impact employees.